Hi, I'm Dr. Yue. We're here for Penny's first laser treatment. We are going to be doing a Skintyte. It's designed to tighten and firm her skin up. It stimulates collagen production. And while I'm working, Rachel's going to be here too.
I'm Rachel, and I'm going to be doing a hydrating mask on Penny after her Skintyte treatment. And during the treatment, I'm going to be doing craniosacral therapy on her to just kind of calm her system and relax her during the Skintyte procedure.
Lucky Penny.
And here's Penny.
And I'm Penny in the flesh. No makeup coverage, just the way I am when I wake up in the morning. They're going to be working on me, so I'm a little nervous about this, as well as I'm shaky and nervous today because I've been cutting down on the many medications that I have been on for a little over 3 years prior to a major back surgery and a fouled up gallbladder surgery. So this is exciting, but bear with me when I'm shaking and turning red.
Okay, it's Dr. Yue. I'm sitting here getting ready to do Penny's first Skintyte treatment. This is a Sciton Skintyte. This machine is awesome. I love it. This is like one of my favorite treatments right now. I decided to do this because I want to overall tighten her skin tone, just everywhere. I'm going to work on her neck and face today. I put gel on here already. I've turned the laser on. We're ready to go. I'm going to be doing it in sections. We're going to do multiple passes over the neck starting right here. So Penny, I'm going to turn your head a little bit this way. Ready? So when it's first firing, you're going to feel like it's almost like just a vibration. The sensation is not really strong. And I'm going to be going over this area multiple times with the goal of heating up your skin. I want it to get up to a certain temperature so that it denatures the collagen. When the collagen becomes denatured, it will reform tighter and your skin will start remodeling. As we do multiple treatments, you'll notice that the skin gets firmer and firmer, and each treatment it gets better. How does that feel?
It feels good, actually.
Does it? Is it hot?
Yes, but it feels
like warm?
Warm.
On a scale of 1 to 10, 10 being burning and 0 is nothing, how would you rate this?
5.
Okay, so that's pretty good. So we're just going to keep going down. So like I said, we're going to do multiple passes. Many people will see a difference right away. I would say over 90% of my patients immediately after the treatment will go into the bathroom, wash their face, and tell me that they see a difference already. A lot of people will tell me over the next 2 to 5 days even more dramatic results, but it continues to get better over maybe 12 up to 14 days. That's what people generally will tell me. So I usually time the treatments about 3 weeks apart. So that's our second pass. How you doing?
I'm fine.
Does it feel like it's getting hotter?
No.
Okay.
It really doesn't.
I'm going to do this 4 times, and then we're going to go on to another section. So we're going to do your whole neck, and I'm going to do your entire face today. The treatment takes about an hour for me to do it. What I want your skin to feel like it's getting warm. It may feel like a slight, almost like a stinging sensation, some people will describe, okay? If it ever gets too hot, I want you to tell me. I will lift my foot off the pedal and move on to the next section, okay? It seems like you're just doing great.
It takes a lot to hurt me, so
I know, you've got
a problem.
Super high pain tolerance. Okay, we're going to go down this one more time. Now I do think that with this treatment, I kind of think of it like going to the gym. If you do one treatment and you don't do any more, it's sort of like going to the gym one time and then you don't keep going. So people always ask me, I mean this is a question I get all the time, how long does the treatment last? Well, we're changing the molecular structure of your skin, okay? It's kind of like when you use a curling iron and you get your hair to curl. The problem is if you don't do another one, it's like going to the gym and expecting those results to last. I mean, or coloring your hair. Changes the hair color, but the grays grow back in. So it works best if you do several treatments to stimulate your skin to remodel. I find that people will get, some people will have more dramatic results initially. I'm going to turn your head the other way and we're going to do the other side. And I think the reason has to do with, some of it is genetics, some of it is what your skin is like, how thick it is, if it's in good condition, what's your nutrition like, are you a smoker? So I think there's a number of reasons why clinically I see differences on different people. Obviously, if someone starts this at a later age and there's more damage to their skin and there's more laxity, it's going to take more treatments. So I try to explain that to patients. You know, I'm not, contrary to Desi's belief, a god.
Yes, you are.
But I do see more and more improvement the more we go. Usually at the 3rd to 4th treatment is when I see the cheek apples of the cheek starting to move up again. And so usually people will do 3 to 6 treatments relatively close together, 3 to 4 weeks apart. And then after that, normally maintenance you can do once every 3 to 6 months, just depending on what you desire to do. So I'm kind of doing this, and while, you know, this is going to take like an hour to do, so I'm going to let Desi show what Rachel's going to be doing down there at the feet.
Hi, Rachel. What you doing?
I'm just hanging out here at her feet, and basically down at the feet is one of the many listening stations where you can just kind of feel a little bit about what's going on in her body based on the craniosacral rhythm, which is it's kind of similar to the heartbeat, but it's different. And what I'm feeling with Penny is a little bit of a lack of sensation. And I'm going to speak to her about this a little bit later. But I can clearly see the shift in her pelvis. And sometimes those with chronic pain actually kind of detach from the sensations of their body. And when you start to compensate the muscles around where you've had injury and trauma, and then the emotions as well, a lot of times you tend to have lack of touch with your body. And so my goal with Penny over the long run is to kind of get her in a new place of getting back in her body again. And instead of always feeling that pain, actually finding areas in her body that actually don't hurt, and sending those messages up through her whole body so that she can be a little bit more in her skin again. And her skin's going to be really awesome because she's going to have all these Skintyte treatments going on.
Amen.
And enzyme therapy treatments that I will be doing later on. And at some point we'll do a treatment where I can actually work up into her head and perhaps do a diaphragm release, which I think she could really benefit from. And also work on her hips a little bit to see if we can straighten her out. So that's it. And I'm just going to hang out here for right now, and just kind of the gentle touch itself can be very soothing. And because she's having a little bit of the withdrawal symptoms, I think just the simple contact while she's having the Skintyte treatment is sometimes very helpful just to calm her system down. So I'm just here. Okay.
Okay, so we finished the laser part of it. I just wiped off the gel off of Penny's face, and Rachel is going to be working on her skin right now.
Right now I'm having her just inhale some lavender oil just to continue kind of calming her system. And then I'm going to use a warm towel to kind of remove some of this gel, the leftover gel that's on her skin. And I'm going to follow that with Beta Gel, which is a anti-inflammatory gel. And it helps kind of soothe the skin. And followed by a hydrating mask that we'll just leave on her for a few minutes to just kind of replenish the skin, and then her treatment will be over.
That smells so good.
Are you sensitive at all?
No.
Okay, so that feels...
That's fine. I'm sensitive in my heart.
That's a good place to be sensitive. Did you have any sensations when we had our hands on you? Could you feel any shifting besides, I know I could feel some spasms going on in your low back. Or were you aware of those, or is it
No,
just...
I am aware of them, and I've been getting a lot of spasms in that area, and really, really bad ones in my butt. It feels like I'm sitting on boulders. And we got one of those big round balls
Yes.
that I've been working on to try to work the piriformis muscles and stretching them and
doing core muscles on it, but I get these spasms. In fact, one night it was so bad I had a heat pack on, and it got so hot that it burned me, but it was like nothing. It was alleviating the pain, no matter what I did.
Well, I want to also encourage you to try to use some of the techniques that you'll be learning of placing your hand on your heart and your hand on your stomach, and just breathe into the pain when you feel it.
Now,
when
what is the purpose of this location?
Well, your heart, for one, and you're bringing aware, by touching it, it reminds you of what your heart is there for, and why you're here. And the stomach as well, sometimes we hold a lot of emotions there. And so, instead of pushing them away or avoiding them, which is so easy to do when you're in pain, I want to actually do the opposite and bring your awareness to that area. And just, so you're holding a place for yourself to be in this pain. Instead of trying to push it away, because for so long you've had to try to push it away to go on and to do your daily life. And so I want to teach you some little coping, some of those tight areas, especially because a lot of times, more so than where the injury is how we compensate. You know, to walk differently, sit, lay, all of that. And actually the pain that we feel is from that even more than the injury itself after time goes by. That's where the chronic pain begins to be more of a problem. So I just put a little hydrating mask on her, and now I'm going to do a little more cranial on her, up here at her head. It doesn't look like much is going on because I'm just going to be holding this area. And again, I felt when we were working a little bit on her hips that there started to get a little bit more circulation in there. It literally felt like there was hardly any movement in there. And a lot of times when there's so much pain, it's almost like a freezer. Because, does it feel like that sometimes to you?
A freezer?
Well,
cold, temperature-wise?
Not necessarily temperature-wise, but just a lack of circulation in those areas.
But when I'm walking, I don't know if this is what you're after, but I start dragging this leg, and
because of the nerve impingement.
And it just drags, and I can feel the muscle spasms as the further I walk, the bigger they get. So I come home and stretch, just try to stretch it out.
And does the stretching cause more pain, or?
It does at first. But when I get in my mindset, then I can let go pretty good. But then when I can't is when I'll take a pain pill and a muscle relaxer.
Yeah.
I try to stay away from them because I have been on them so long that obviously I'm addicted. Because it's been 3 years that I've been on medication.